Hey everyone, how's it going? This is Dr. Brian Adkins with the Adkins Academy, going live again. We had some technical issues with our previous video, so just wanted to redo it. Make sure you guys get the concepts, and we drive the point home. And so certainly we'll give you some repetition here, I guess. Today we're going to do our question of the week, and so just wanted to go over experimentation and understanding the variables within experimentation. So we've had a lot of great responses on our Facebook, Instagram, and Twitter pages regarding our question of the week, and certainly love and enjoy your responses, and would love to hear more from you. And so let us know if you want to see any particular types of questions. We can always go over them and feature those as part of our question of the week. And so we did have a challenge that Natural Beauty 25 and some other individuals wanted additional questions that were a little bit more difficult, a little bit harder. And so we're happy to oblige and certainly give you some questions that will really challenge your intellect, challenge your ability to really work through the question and think through the questions. And so we'll have additional questions throughout the month and with our weekly, our question of the week, that will certainly challenge your understanding of science, English, reading, and also math, but also other concepts as well, and really integrate your knowledge. And that's part of what we do with our TEAS and HESI and prep courses, but also our NCLEX course as well. Okay, and so we'll get right into the question of the week here. And so with our question of the week, we want to know about a clinical trial where we are assessing the effects of Lipitor on dyslipidemia, and so high cholesterol levels. And so we have three different doses of atorvastatin, so Lipitor, were given to 2,000 patients between 50 and 60 years of age, right? And so all males. And so we're controlling for gender. We're controlling for age, or at least age ranges for that matter. But also we're making a large, we're gathering a large enough study, right? A large enough participant pool, I should say, to really validate the study results. And so each of these individuals have cholesterol levels between 280 and 300, and so those are higher than what we normally like at about 240, and so milligrams per deciliter. And so with no previous history of heart disease, so no heart attacks, no DVTs, things like that, and so no history of heart disease or congestive heart failure or heart attacks or these types of things. And so with that, which of the following identifies the role of the 2,000 patients? And so the 2,000 patients we also have the different doses of cholesterol. We also we have the different doses of Lipitor, I should say. We have the different amounts of cholesterol in terms of 280 to 300. And so we have different variables within this experiment. And so what we want to do, we want to identify what role does do the patients play in this. So what role do the 2,000 patients play in this? And so with our course, we'll certainly talk about different variables and different aspects of the experiment. And so some of those variables that we want to know about today are, for example, our independent variable, our dependent variable, but also our controls and our confounders as well, not co-founders, but confounders as well. And so in terms of this, our independent variable is what you choose. Hey, Benu, thanks for tuning in. And so this is what you choose. And so this is what we choose. And so as an experimenter, we're going to choose the different doses of Lipitor. And so let's say that we have 10 milligrams, we have 50 milligrams, and let's say that we have 100 milligrams. And so in this case, we chose those different doses. We could have chosen 25 milligrams. We could have chosen 13 milligrams. Why 10 milligrams? Why 50 milligrams? Why 100 milligrams? And so that's a part of your research in terms of figuring out what dose works best for your particular experiment. But the fact that you have the ability to change those doses and choose those doses, that automatically makes that your independent variable, right? So your dependent variable is what you're trying to measure. So whatever you're trying to measure or whatever you're trying to determine, this is your dependent variable. So whatever you're trying to measure, whatever you're trying to determine, that becomes your dependent variable. The controls are the things that you're going to hold constant as much as possible. You're going to try to hold these things constant. And so you're going to use male patients, and so not male and female patients. You're going to use patients who are around the same age range, so 50 to 60. So you're not going to compare the effect of Lipitor on a patient who is 20 years old versus a patient who is 66 years old. And so, with that, we want to try and control as much as possible for the variables, including age here, but also comorbidity status. And so we want patients who do not have a history of heart disease. And so we want to control for health status as well. And so we're trying to keep all of those things, other things, constant. So we don't want to compare the effects of Lipitor on a patient who has had 3 strokes and 2 heart attacks versus a patient who has never had a heart attack before, or a stroke, or has any other heart disease. And so we want to make sure that we're comparing apples to apples to apples and not apples to oranges. And so that's also a very, very big part of understanding experimentation. And so they definitely want you to understand that for the TEAS test, but also for the HESI and the NLN exams, but also for the NCLEX exam, all of which we certainly help you to prepare for. And so you also want to identify things like your positive control, so your positive control, but also your negative control. As we talk about these different variables during our class time and during our science class, we go in depth and talk about these different variables, our positive control, our negative control, our independent variable, but also our dependent variable. We give lots of examples. And so, for example, one of the ones that we talk about during the class time is if you are trying to figure out how much water do you need in order to get a crop of strawberries, right, for example. So let's say you vary the amount of water. And so you know that if you use 1 liter of water, you'll get a strawberry. What happens if you use 500 milliliters of water? What happens if you use 250 milliliters of water? What happens if you use 100 milliliters of water? Will you actually get the presence of a strawberry, right? And so in that case, our independent variable is the different amounts of water, right? Whereas our dependent variable is going to be what we're trying to determine, which is the presence or absence of a strawberry. Okay, our controls are the things that we're going to hold constant. So we're going to use the same type of soil. We're going to use the same amount of soil. It's the same sorry, I had a phone call there. We're going to use the same number of seeds. We're going to use the same amount of soil, for example. We're going to water the plants at the same time of day. We're not going to change those things. Again, that now confounds the results. And so a confounding factor is something that could affect both the dependent and independent variable. And so we don't want to affect the different variables. We want to try and hold the variables constant, the other variables constant as much as possible, and just check assess the main thing that we are changing, which is the amount of water, for example, with the strawberry experiment here, right? But obviously, same thing with the cholesterol experiment. We want to use different levels of Lipitor to see if they lower the cholesterol levels and say, hey, below 240 or even lower than that for our patients. And so we're going to control for the gender, we're going to control for the health status and other things. And so controls are a very, very big part of experimentation. And so we want to make sure that we try and do that. And so we also want to, like I said, try and get rid of confounding factors. So things that will certainly affect, clearly affect our independent variable, but also our dependent variable as well. So things that will affect the dependent variable and the independent variable. So we want to get rid of those confounding factors as much as possible and really try and focus more so on just our independent variable and making sure that whatever result we get in terms of our dependent variable, whatever that outcome is, it's totally dependent upon in the result of, there we go. And it's totally dependent in the result of our independent variable in our experimentation here. Okay, and so that's just a little bit about experimentation, and on a very basic level, our independent variable, dependent variable, our controls, our confounders. And so in this case, with the 2,000 patients, that's going to be a part of our control. And so definitely we have more challenging questions coming. We have one question of the week that we'll do, and we do a live feed every Monday at 7 p.m. Around 7 p.m. or at 7 p.m. To go over the question and explain the question. Certainly give you some insight into the questions. But if you want to see more questions like this, you want to go over well over 500 questions like this, then certainly feel free to give us a call, because this is what we do all the time with our TEAS course and our HESI course. And so on Sundays and Wednesdays, we have our classes where we go through science concepts, we go through math concepts, we go through English concepts, but also reading concepts, and talk about how to really understand these exams, how to really perform well on these exams, but also how to strategize your your application so that you can actually get into and be a very competitive candidate and get into nursing school, right? And that's ultimately the goal. We also work with our clients on getting them past the NCLEX exam. And so in terms of preparing them to perform well on the NCLEX exam and ultimately get that job that they're looking for. And so we can definitely help you to do that. And so if you like this and like this explanation, but also want to see more and have more explanations, then feel free to reach out to myself and my team anytime. The office line 301-960-4950. We love to hear from you, tell you more about our program, and have a direct conversation with you. With our course, especially our TEAS and HESI prep course, well over 35 hours of actual class time. That's not you're not getting that with any other company out there, right? And so we can definitely, hey Kevin, how's it going? Thanks for chiming in. But we can certainly we provide you with more class time than anyone else. We provide you with more questions and content than any other company. We also provide you with more personability. And so you can absolutely give me a call directly, give my assistant a call directly. All of my clients have my cell phone number, so they can certainly reach out to me for any questions that they have at any point. And so you can call me or text me or email me for any questions that you have. Once you join our course and during our class time, in our office hour time, you can certainly reach out to us anytime for any questions. We're happy to go over additional questions with you. But it doesn't stop there, because with our course, you can also retake classes. Let's say you didn't really get all the science because it's a 9-hour science class. You didn't really get it all. Well, let's do it again. Okay, if you want to redo the math class or redo the reading class or redo the English class, then I'm happy to go over it with you and certainly have you to be a part of that class again, so that we make sure that you understand the concepts very well. And so I'm happy to go over any concepts with you and make sure that you understand the concepts very well, as we said. But with our course, we also provide you with a guarantee where you can come back and retake our entire course again for free if you don't get at least an 85 or better. We want you to be in the 80s and 90s, not the 40s and 50s and 60s. There's some other programs, their guarantee is like a 62. That's not what we do, right? And so with our course, the goal is to get you into the 80s and 90s, okay? And if you don't get there, then you can absolutely come back and retake our entire course again for free. And with most other programs, you got maybe a month to do that. With our course, you have up to a whole year to come back and retake our entire course again for free if you don't get at least an 85 or better. And that is the 96th percentile. And so if you don't get your score into that 96th percentile and you're not very competitive with getting into your nursing program, your BSN program, or your ADN program, then certainly feel free to come back and retake our course again. We'll help you get a 95 this time, okay? And so again, I'm Dr. Brian Adkins with the Adkins Academy, and I teach a lot of the classes with our NCLEX course, our TEAS course. And so, like I said, you can certainly reach out to us anytime. Again, the number 301-960-4950. Okay, and so we also post our videos on YouTube, so definitely look at the Adkins Academy YouTube channel. Subscribe to our channel. You'll get notifications when I post additional videos. But also, we do our Facebook Live feeds on Mondays at 7 p.m. Eastern Standard Time. And so, love for you to certainly not only answer our question of the week, but also provide us with questions that you'd like us to go over. I'm certainly happy to provide questions and give you a challenge, but I'd like to know what you guys want to do and what you guys want to go over. And so, feel free to reach out to us and let us know what you'd like to see, and we're happy to create questions that are more reflective of things that you'd like to see as well. Okay, so feel free to reach out to us anytime. Again, 301-960-4950, and certainly subscribe to our Facebook page, but also our YouTube channel, and you'll see a lot more videos that we have up there as well. All right, thanks a lot for chiming in and tuning in. Feel free to reach out to us anytime. All right, AdkinsAcademy.com, and again, you can reach us directly 301-960-4950. Hope all is well. Thanks.